Hi, how are you?
Good, how are you?
I'm good, thank you. My name is Anel. I'm gonna be the student nurse today, and I'm just gonna be asking you a couple questions.
Okay.
May I first ask your name and date of birth, please?
Gibran Ortiz.
Gibran Ortiz.
Yeah, February 24th, 1990.
Gibran Ortiz, February 4th, 1990. How would you like me to address you?
Gibran is fine.
Gibran is fine? Okay, Mr. Gibran. So you said February 24th, 1990, so you are 30 years
Correct.
old. Okay, and where, your birthplace, where were you born?
I was born in Mexico.
You were born in Mexico? Okay. Are you married?
Yes.
Yeah? How long?
9 years.
9 years? Oh, congratulations.
Thank you.
Where do you work?
Right now I work at Rainforest Cafe.
As a
Server.
server?
Mm-hmm.
Is it full-time or part-time?
Part-time.
Part-time?
Mm-hmm.
And may I ask you what brings you in today?
I'm here for a physical.
You're here for a physical?
Mm-hmm.
Okay. Do you have any kids?
I do. I have two.
2 kids?
Mm-hmm. A boy and a girl.
A boy and a girl. Can I get their ages, please?
One is 6 and one is 1.
1 6 and 1 year old.
Mm-hmm.
The boy is
The boy is the 6-year-old.
6-year and the girl is the 1 year old. Okay.
Mm-hmm.
May I ask your religious preference?
Catholic.
Catholic. Okay. And besides your physical, is there any complaint that you have? Like, are
No.
you feeling any? No. Okay. Do you have any present illness?
No.
No.
Not that I'm aware of.
Not that you're aware of. Okay. And do you have any history of any illness?
Mm-mm.
Any kind of illness? No. Okay. Have you had any surgeries?
I have. When I was 2, I was in the hospital because I burned my leg.
So you So you burned your leg.
Mhm.
Which leg?
The right leg.
You burned the right leg.
Mhm.
At 2 years old. Have you had any issues
No.
from that injury? No.
Mm.
Have you had any childhood illnesses, like
No.
chicken pox?
I've had chicken pox.
Chicken
yes.
pox.
Mhm.
Yeah? And with the accident, you had the burn on the right leg, right?
Sure.
Okay. Have you had any hospitalizations?
No, I mean I was in the hospital for a sprain when I was like 18 or 19, but that's about it.
Okay. So sprain,
An ankle sprain from playing soccer.
ankle sprain from playing soccer.
Mhm.
And have you had any pains
No.
ever since that? No. Is your ankle okay?
Mhm.
You're doing okay. Okay. And you said no surgeries, right?
Correct.
Okay. Are your immunizations up to date? Have you gotten all your shots?
Yes.
When was your last time that you had a physical?
Last year.
Last year, a year ago? Do you have any allergies?
I do. I'm not exactly sure what I'm allergic to.
You're not exactly sure.
No, when I take like over-the-counter medications for like fever, like Tylenol,
Tylenol,
Motrin,
Motrin.
Mucinex.
What
stuff
type of
like
allergy do you have with that?
I break into hives,
You
and
have hives?
my fever gets worse if I have a fever, or my headache gets worse if I have a headache and stuff.
Okay. So hives. Where did you get the hives?
Oh, all over my body.
All over your body? Okay. So you don't feel like you have any trouble breathing or anything?
No, it's just a rash, and
just a
then
rash?
getting like worse from the fever and stuff like that.
Okay. And you said you're not 100% sure, but it's been when you don't remember exactly, it's just Tylenol,
Yeah, it's just
Motrin.
whenever I take certain medication, like over the counter for like fever.
Okay.
Mainly.
Are you in any current medications?
No.
No? Are you taking any vitamins or supplements?
Yes, I'm taking OPC3, omegas, and just multivitamins.
Multivitamins? Okay, right now I'm going to ask you for your family history. So I'm going to be asking you for your mom, dad, your grandparents, your brothers.
Okay.
Is there any history from heart disease in your family?
Does high blood pressure count?
High blood pressure? Yeah, high blood
Yeah. So my dad's mom suffers from high
Your
blood pressure.
dad's mom?
Mhm.
Is she alive or in what?
She's alive.
Dad's mom, okay. Anybody in your family had a stroke?
Yes, my grandmother from my mom's side.
Your
My mom's.
mom's mom?
Mhm.
Is she alive?
No, she's
No?
deceased.
She's deceased. Any history of diabetes?
Yes, from both sides. From my dad has diabetes.
Your dad has diabetes?
My mom's mom had diabetes. And I believe my grandfather from my mom's side of the family had diabetes as well.
Okay, so you have a history of diabetes in your family. Okay. Any blood disorders?
No.
No?
Just a high blood pressure.
High blood pressure for your dad, from your dad's mom, and any breast cancer in your family? No. Any other type of cancer?
No cancer that I'm aware of.
Not that you're aware of. Okay. Arthritis?
Arthritis. My mom suffers from arthritis.
Your mom? Any allergies besides you? Like anybody else in your family has allergies?
Oh yeah, my dad is allergic to like certain like perfumes, and he's allergic to gold, certain minerals. Like he can't wear like gold necklaces and stuff.
He gets a rash. Okay.
And my older brother is allergic to the sun.
He gets like.
Yeah, he gets rashes from
being
in contact with the sun for too long.
Okay. Anybody in your family has asthma?
I think I had asthma when I was very young, but I grew out of that.
How old were you when they?
I think I was like 4.
4?
4 or 5. But I haven't had anything after
no
that.
Issues after that? Like you've not
I play soccer
okay.
and everything, and I'm perfectly fine.
Okay. Is there a history of obesity in your family?
Yeah.
Yeah? From
Definitely,
your mom?
from
or
both sides of the family.
Both sides of the family? Any history of alcoholism?
Definitely.
Yeah? Both sides of the family?
Mostly my dad's side of the family. My mom's not really. But I think just one of the uncles from my mom's side. But most of my dad's family, side of the family. Uncles, my grandfather.
How about your grandfather or your grandmother?
My grandfather died of cirrhosis because of alcoholism.
Okay. I'm sorry to hear that. Any mental illness?
No.
No? Does anybody in your family?
Mom suffers from depression.
Your mom suffers from depression? Okay. Did you suffer from depression?
No. I mean, I was depressed a little bit, at a certain point. Like, that was a long time ago, though. But it was just like a momentary thing, I believe.
How long ago?
Before I got married. So about 10 years ago.
10 years ago? Okay. Have you had any other recent episodes? Any seizures? History of seizures?
No.
No?
Not me. I have family members that have suffered from
your
seizures.
grandparents, your parents?
Not my grandparents or parents, just like cousin that suffers from epilepsy.
Okay. Any kidney disease? Anybody has?
No.
In your family? No? Has anyone in your family had tuberculosis?
No.
No? Okay. Is there any other disease or anything in the family that I have not, like, that comes up to your mind?
No.
No? Okay. And how old is your mom?
My mom is 54.
And your dad?
56.
56. And you said your brother, do you only have one brother?
I have 2. I have an older brother. He's 35. And I have a younger brother who is 26, 27?
26?
No, I'm wrong. He's 28.
28? Okay. Yeah. 28. Oh, so you're the middle child?
Yes.
Okay. And both parents are alive, correct?
Correct, yeah.
Okay. And only you said your dad's mom is alive, and both the other. So pretty much you only have one grandma alive, and the rest are deceased, correct?
Correct.
Okay. Have you? Do you know your present weight right now?
Last time I checked was 200 pounds.
Okay. Have you gained or lost in the?
Actually lost weight.
Missing weight?
Yeah, slowly, but.
Do you know how much?
So far I believe it was like around 8 pounds.
8 pounds. Okay. Are you aiming to lose more weight? Or?
Yes, definitely.
Yeah.
eating less, portion size.
Do you have a goal?
Yeah, I mean, I would like to be at least to 180.
180?
Little by little, but I'll get
Are you very active? Do you do exercise regularly?
not a lot, but I keep active here and there for the most part, at least 2 to 3 times a week.
2 to 3 times a week you go do exercise? Okay. And do you see 180 pounds as an attainable goal?
Definitely.
Okay. Do you have any history of eczema? You did say you have hives, right? You get
Yeah,
hives with
just from the
medication?
allergies. Yeah, just I break out in hives from.
Have you had any changes in your skin? Any
No, I did.
something irregular that you've noticed?
I did get I do get stress rashes here and there when I'm really stressed out.
You
But
do like how do you get where do you get the rashes?
it's just random spots. I had it in my head and I had it on my back and in my chest.
So you broke out and
Mm-hmm.
and you say the reason you say stress is
Stress.
okay.
Mm-hmm.
Okay. Have about any recent hair loss?
No.
No. Headaches? Do you suffer from headaches?
No.
No. Have you had any head injuries? Do you suffer from dizziness or vertigo?
No.
No. Okay. How's your vision?
As far as I know, 2020.
2020. When was the last time you went to the doctor?
About 2 years ago.
2 years ago. Okay. Do you have any eye pain?
No.
Redness, swelling in your eyes? No.
No.
Do you wear glasses?
No.
No. No glasses. No prescription. Nothing. Okay. Have you had any ear infections?
No. Not
No?
recently.
Not recently. Do you feel any issues with hearing?
Not at all.
Do you have any frequent nosebleeds, sneeze?
No.
And you said allergies to medication. Any change of smell, sense of smell?
No.
Okay. How about your do you get frequent cold sores
No.
or bleeding gums, toothache?
No.
No. Have you had any lesions in your mouth or tongue?
Nope.
No. Any hoarseness or voice change?
No.
Have you gotten your tonsils?
It's
No?
still there.
Still there?
Mhm.
Okay. When was the last time you visited the dentist?
Ooh, probably about 3 years ago.
3 years ago?
Mm.
How frequent do you brush or floss?
At least twice a day.
Twice a day?
Probably
Okay.
should do it more often.
Twice a day is good. Maybe you can, if you want to, you can probably add one more.
Mm.
Do you have any neck pain?
No.
No? Have you felt like any lump or swelling? Nothing? Okay. How about, you said you did have a history of asthma, but that was when you were only 4 years old, right?
Correct. Yeah.
Okay, and after that you don't have any difficulty breathing?
Not
No?
at all.
Okay.
Mm-mm.
Do you have a difficulty sleeping?
Not really. I mean,
Breathing
unless like the room is
while you're
really
sleeping?
hot. But no.
Have you had any history of pneumonia or any other infection?
No.
No? Okay.
I snore a lot.
You snore a lot?
Very loud.
Very loud? Do
Mm.
you feel like that's snoring? Like, does it wake you up? Does it keep, like, does it...
It doesn't wake me up. Maybe my wife and
Your
kids.
wife complains about it?
Yeah.
Any history of heart murmurs?
No.
No? And you don't have a history of high blood pressure, or do you
I
feel
don't.
any palpitation in your heart now?
Mm-mm.
Have you felt like you get swelling in your legs or your hands?
When I'm on my feet for a really long time as a server, your
Yeah.
feet tend to swell.
How many hours are you on your feet when you're as a server?
I've been more than 12 hours when I work a double, depending.
How many hours is a double? Like 12 hours?
About 12 hours.
12 hours that
Mhm.
you're on your feet, and that's when
Yeah.
they swell up?
Hmm.
Only your feet?
Only my feet.
Okay. Do you have any history of ulcers?
No.
No? How is your bowel movements?
Regular,
Regular?
About
When you say
twice a
regular,
day.
twice a day?
at least.
Okay. Do you have any pain, abdominal pain, any nausea?
No.
No? Have you had any history of urinary tract infections?
No.
No? Have you had any painful urination or...
No.
No? You are sexually active, right?
Yep.
Okay. Do you use condoms?
No.
No. Have you ever had any partner who has been with a sexually transmitted infection?
No.
Do you have a history of arthritis?
No.
No? Okay. And you said that sometimes you do walk like 12 hours a day, right?
Yes, definitely.
Okay. And you said no history of seizures, no stroke. I'm just kind of trying to repeat back just to make sure that I'm not missing something. Do you bruise often?
No.
No? Does anybody, have you had any change in pigmentation in your skin?
No.
No? Do you sweat excessively?
Not excessively.
No? How did you feel? Do you feel
Healthy. Yeah.
healthy? Do you feel healthy? You feel you're healthy? Do you feel like, are you depressed? Do you feel...
Not at all.
No? When, what's the education that you've completed so far?
Some college.
Some college? How would you describe your self-care behaviors? Like, how do you feel you're taking care of your body?
I think I've taken care of my body for the most part. You know, I
You
stay
eat well,
active.
you
I
stay
try
active.
to eat as healthy as possible. Take vitamins, supplements, stuff like that. So
How is stress in your life right now?
right now, not very stressful.
No high stress? Has there been change in stress over the past years?
I'm sure there's more stress here more at times than others, but nothing too over the top.
No, okay. How do you relieve with stress?
Exercise
Exercise?
or video games.
Video games? Are they helpful? Do they help you?
Yeah.
Okay.
Distract, release stress.
Okay. Do you drink caffeine? Like coffee, soda,
Yes.
tea? Yeah. How often?
Coffee. Coffee. I drink it at least every other day.
Every other day?
Mhm.
1 cup, 2 cups?
1 cup.
1 cup.
1 cup
Do you
is
smoke?
plenty. No.
No? Do you drink alcohol?
Socially.
Socially? How often is socially?
About 4 times a month.
4 times a month?
Mhm.
When was the last time you had alcohol?
The last time I had alcohol was about 2 months ago.
2 months ago?
Mhm.
Okay. How much alcohol did you drink at that time?
Like a couple
1,
beers.
2 beers,
Mhm.
3?
2 beers.
2 beers?
Mhm.
Okay. Have you ever had a drinking problem?
No.
No? Okay. Do you use any recreational drugs or street drugs?
No.
No? Have you ever been treated for drug or alcohol use?
No.
No? Okay. What type of neighborhood do you live in? Housing?
I rent.
Okay. Is it safe in the area? Yeah. Do you have adequate heating and utilities?
Mhm.
Yeah. How involved are you in the community service?
Not very involved.
Yeah. Is there any hazards at work or home that you would like to address?
No.
No. Do you use your seatbelt
For the most part.
for the most part? It's always good to use your seatbelt. Have you traveled to any country in the recent couple months?
Not in the last couple months.
Okay. Do you also live in other countries? Like, are you like
No, I
Or
don't
do-
live there. I visited, not very often.
not very often? Okay. So, do you have any other thing that you would like me to put down? Any other complaint that maybe you forgot to tell me?
No.
No. Okay. So far, you said you didn't have any chief complaint. You just pretty much just came for a physical. Do you have any questions for me?
No.
No? Okay, so I'm just gonna pretty much just gonna go get the doctor for you. It was nice meeting you, and
Nice meeting you as
we'll be
well.
right with you. Okay.
Thank you very much.
Thank you.